So warts are nothing but benign epidermal proliferations caused by human papillomavirus, and they they can have manifestation in skin as well as in the mucosa, and they can get transmitted through contact, okay, direct and indirect, and sexually they can get transmitted. They can transmit from mother to fetus during pregnancy and labor. Usually during the labor, they get transmitted to the neonates. So based on the manifestations of the human papillomavirus, they can be classified into non-genital HPV infection and genital HPV infection. A non-genital HPV infection can have cutaneous manifestations and mucosal manifestations. In cutaneous manifestation, they cause warts. Okay, and they might cause epidermodysplasia verruciformis (EDV). And mucosal manifestations could be laryngeal papillomatosis. It can there be oral involvement like oral papilloma. Okay, and genital HPV genital infection. So low risk caused by the low risk HPV viruses, that is HPV 6 and 11. High risk are HPV 16 and 18. So this low risk HPV viruses 6 and 11 causes genital warts. Otherwise called condyloma acuminata. And high risk HPV viruses causes cervical cancer in females. There can be Bowen's disease, gonoid papillosis. There can be Buschke-Lowenstein tumor, that is a variant of SCC. Okay, and ED is caused by the HPV types E3, 5, 8, and 9, and X disease caused by 13, 24, and 38. So let's see what the cutaneous warts. So cutaneous warts are of different types, and the most common is the commonest type, that is verruca vulgaris. It is caused by HPV type 2 and type 4. 2 is more common than 4. Okay, and as you can see from this picture, there is a skin colored hyperkeratotic papule with verrucous surface. Okay, and usually seen over the trauma prone sites like hands and feet. So if cause hyperkeratotic papule with verrucous surface is hands and feet. And filiform warts are caused by the same HPV types 2 and 4, and you can see there is filiform projections. Okay, there is filiform projections of the epidermis of the warts. Filiform projections will be seen, that is why it's filiform warts, and usually seen in the head and neck area. Okay, next is plain warts. Plain warts are caused by the virus HPV type 3, 5, 3, 10, and 28. Okay, so plain warts, you can see in this photo, these are skin colored, smooth, flat topped papules, mostly seen in children, mostly seen in the face. Okay, so they are flat topped papules seen in children, seen in face. Just what is caused by the HPV type 7, it is seen in the handlers of raw meat. It's seen in the hands and the handlers of raw meat. And they can be warts in the palms and soles. It's called palm plantar warts, and it can be superficial or deep. Superficial variant is the mosaic variant, which is having the HPV. It's called by HPV type 2 and 4. Myrmecia is the deep variant caused by the 1. Okay, so they are superficial. Myrmecia deep. Superficial, they are painless. Deep ones are painful, and they have a hyperkeratotic core in the deeper skin. Okay, and the condyloma acuminata, it is caused by the HPV type 6 and 11, and it's an anogenital warts. Okay, these are the common types of cutaneous warts and the HPV types and the clinical features. And one another clinical feature which you have to know is this appearance, like the linear appearance of multiple warts. Okay, this is called pseudocombinous phenomenon, and this is because of auto-inoculation. Because of scratching, there is a micro trauma over the skin, and which is causing impaired barrier, and this impaired barrier causes the HPV to enter to the traumatic sites. So they get auto-inoculated because of scratching and because of trauma like shaving, and this gets arranged linearly, giving an appearance of a Cobnus phenomenon, but it is not actual Cobnus. This is just because of auto-inoculation, so it's called pseudo-Cobnus. So auto-inoculation, it is pseudo-Cobnus. Actual Cobnus phenomenon is immunological mediated, whereas in pseudo-Cobnus, this is because of the auto-inoculation. Okay, and mostly these warts undergo spontaneous resolution, but it takes time over a period of 6 months to 1 year. Mostly 40 to 60% of the warts get cleared by themselves. And if you want to confirm, it's mostly clinical diagnosis, but suppose if you want to confirm, then you can do a skin biopsy which should show coilocytes. Coilocytes, these are the keratinocytes. You can see these keratinocytes have a very pycnotic nuclei which is eccentrically placed, and there is a hollow space in the cytoplasm. Okay, so they are very pycnotic nuclei, eccentrically placed, and with the perinuclear halo. Okay, so how do you treat the patients? As I told earlier, they are very difficult to treat and they do not respond to the antivirals. So the only modality of treatment is destruction. So you can give ablation. You can do ablation by cryotherapy or electrocautery or radiofrequency ablation. Okay, and for plantar warts, you can do paring, or you can just apply trichloroacetic acid for chemical ablation and inflammatory response, which will increase the immunity and which will try to lead to quicker resolution of the HPV infection. This TCA touch, trichloroacetic acid touch, or that you can apply for planar warts. You can apply retinoic acid, which is a keratolytic. Okay, and for plantar warts, you can also give topicals like salicylic acid. And for genital warts, you can apply podophyllin. Okay, you can give imiquimod. Imiquimod is an immune stimulator. It's a topically applied formulation. And if it's resistant to treatment, you can give immunotherapy in warts. Immunotherapy is you give intralesional, either in the wart, you give injection of the antigens like MMR vaccines, Candida, MW vaccines. So you'll inject these injections or antigens into the warts and you try to elicit the immune response. Okay, by increasing the immunity, the body's immune system try to find the HPV virus and they try to resolve it. Okay, They try to destroy the HPV virus. You can also give intralesional bleomycin. Okay, this is about the management of warts.